Thanks for having me here. I'm actually, I gave this talk in my department, and what I did is I actually made it more specific to social work. So the videos are about social work specific, and all the examples I'm going to be giving are specific to social work departments and to positions that you all might be in. So I think it'll make it a little bit more accessible and easier for us to have some conversations. My hope is that we probably won't get through all the material, but I do want to have some time for discussion, so I will leave some time maybe at the quarter hour so that we can at least ask questions and have some conversations about things. Like I said, we probably won't get through everything, but if you want, we can continue the conversation at some other point. You can always email me and we can chat. So I have this overview of things that we're going to be talking about. I'm also a licensed psychologist in addition to being a professor, so I'm engaged in clinical work often, and I have experienced microaggressions as a queer person myself, but also, we all microaggress, and so I think part of this too is having a conversation about what we do when we microaggress, not if we do it, but it's when we do it, because I think part of having this conversation is just having some humility around the fact that this happens, and then how do we deal with it when it does. So I'm not really going to do too much on terms, because my experience with giving these talks is that most people have at least some rudimentary understanding of some of these terms, but if I do use some language that you aren't familiar with, just raise your hand and I'll quickly respond, and then we'll go through some of the definitions of microaggressions and some examples. So these are just this is the only term slide. Sexual orientation, when I talk about it, refers to somebody's attractions, sexual behaviors, and fantasies, so that's what I'm talking about. Everybody has a sexual orientation. And then gender identity is an internal sense of your gender. Usually it's on a masculine to feminine spectrum, but can be outside of that as well. So it's this internal felt sense of who you are. I'm going to be using LGBTQ as the umbrella term for today. And often, if you have any questions about any of these terms that I'm going to be using, then let me know. The ones that people usually ask me a little bit more about are trans and queer. So trans is referring to somebody whose sex assigned when they were born is different than their current gender identity. And then queer can be a whole umbrella term for a whole host of things, but it's usually some type of sexual minority status, saying I'm attracted to a whole bunch of different kinds of people. But ask somebody if they use that term, because it can mean something different for different people. Cisgender refers to somebody whose sex assigned at birth is the same as their current gender identity. I identify as cis. So I was assigned a female sex at birth, identify as a woman now. And then the binary is the last term that I'll mention. So this idea that there are opposites of things. So this term opposite sex, which please don't use that terminology, but that's like man or woman, that they're opposites, or that you are gay or you're straight, right? So all these things are on spectrums, and that there are lots of different gradations of these identities. So we usually critique the binary when we talk about it. And if you want, we can talk more about that at the end if you have some questions. So there's a lot of words on this slide. I'm not really going to go into a lot of the information on here. You can kind of read through it as I'm talking. But basically, for therapy trainees, it seems like there's more bias for sexual minority men than for women. So that's something to kind of consider when we're considering exactly what it means for the clients if we're working with them in a therapeutic setting. Students talk about an overwhelming lack of training that they have in their programs. And so part of this is kind of considering, if you all are faculty in the social work school, then kind of thinking about how is it that you actually talk about LGBTQ identities? Is there a day that you talk about it? And if that's true, then talk to me, because we can talk about some ideas how to infuse some of these concepts within your courses. Or if you don't talk about it at all, I've talked to some social work students, and there's a sense that faculty are afraid to talk about LGBTQ issues. And that's true in my department as well. And so part of the sense of what are faculty afraid of? And sometimes it's this fear of, well, we want to affirm everyone. So if there are people who have maybe a religious bias or some other type of bias related to LGBTQ identity, faculty feel afraid to really get in on that. And so if you want, we can talk a little bit more about that. But also, if you're a student in those classrooms, like what exactly is happening? How do you manage that for yourself, and kind of consider how to have some of those conversations. But also, and I'll just say this last one here, is that a study that just came out had 14% of faculty in social work endorse negative attitudes toward LGBTQ individuals. And when I saw that, my first reaction as a queer person, I was like, oh, it's only 14%. And then as a faculty member, I was like, it's 14%, right? And so I know that I'm kind of focusing on faculty here, but I think that there's this sense of, like, if we're the ones who are educating, I think it's important for me to think of myself as an educator. How am I passing along some of this information to my students? And as students, what's your role? and your responsibility in your training programs. Okay, so microaggressions, this is the definition of microaggressions, and basically they're commonplace, either comments that people make, behaviors, actions, or environmental indignities that indicate to somebody that there's some type of slight or some type of difference that they have that isn't acceptable. So there are 3 types, and we're going to talk about these right now. So the first one are micro-assaults. And honestly, we can talk about the word microaggression at some point if you all want to have a discussion about it, but sometimes this is just plain old discrimination. So we can talk about some of the language behind this. But basically, these are blatant verbal or nonverbal messages that are intended to be discriminatory. So for example, the use of a slur. And often this happens if somebody feels like it's going to be anonymous, or if they feel like there's a group of people around them who also have similar, these similar beliefs or ideas. Sometimes it happens also when people lose control of their feelings, but I think this is an important thing to consider, when you're at your prac sites or if you're at your field experiences or in classrooms. If something does happen, what's preventing a conversation from happening or some type of intervention from occurring when a microaggression happens? Another one is micro insults, and so these are either unintentional behaviors like cutting off eye contact with somebody when they make you feel uncomfortable, and this is usually unconscious, or verbal comments that convey rudeness or insensitivity. So let's say that a clinician, social worker continues to forget a patient's or a client's correct name or pronoun. Or if you're working with a client, oh, before you meet this person, I should warn you, she's a lesbian, right? Or, oh, he's so gay, have you seen the way he dresses? So these are kind of messages that are given to indicate some type of usually unintentional message that you're wrong, you're different, there's something abnormal about you. And then this last one is microinvalidation. So these are usually it's dismissing somebody's identity or excluding someone based on this idea that the privileged identities are the norm and that's how it should be. So for example, if a heterosexual person says, I don't care about sexual orientation or gender identity, we're all humans. And I have this hashtag All Lives Matter, this trans woman who's on the internet, she kind of blogs about some of these pieces specifically related to intersectionality, which we really won't get into too much today. We're talking about LGBTQ identities, and really when we're talking about marginalized identities, often people don't just have one identity, right? We have multiple identities, but this thought of, your identity doesn't matter, we should really just still pay attention to the norm, that can be this micro-invalidation. But we're not going to really go into those 3 pieces. I just think it's important to define that those are 3 different groups of microaggressions. What I'm really going to focus on today for the talk is here are microaggressions that I have seen happen in classrooms or in practicum settings or in different places that seem like they'll pop up. And not only hear examples of kind of what happens, but also the message that gives somebody when the microaggression happens. So the first one here is this assumption that your sexual orientation or gender identity is the cause of all of your presenting issues, right? And so this happens a lot in the mental health field. So let's say a clinician says to a client, well, it really seems like your problems stem from your sexual orientation or your gender identity. So someone comes in your office who identifies as an LGBTQ person, but they're like, I'm coming in because I have, I really need some help transitioning my job, and I want to talk about some of the stress related to that. But they don't say anything related to their LGBTQ identity. It doesn't come up. They don't mention it as being an issue. But then you say, oh yeah, we really focus on your LGBTQ identity. And the message here is that your sexual orientation or your gender identity is the problem, right? So we really need to focus on that piece. Or when a client discusses some type of medical issue or something else that's unrelated to gender identity or sexual orientation, and a physician interjects questions. So this is more of if you're in a medical setting and you really focus on something that doesn't have anything to do with gender identity. And so your sexual orientation and gender identity needs to be treated. So the flip side of this, where some of this starts to get a little confusing, is this one, which is, so that was overemphasizing an LGBTQ identity and saying we really need to focus on that even when it's something that you say isn't part of the problem. And then the flip side of that is avoiding or dismissing or sharing some type of discomfort or disapproval. So let's say a social worker just avoids using LGBTQ terminology in general. So, I don't know what to say about this person, so I'm just not going to say anything at all. So the message here is that issues related to your sexual orientation or gender identity aren't important to talk about. Or let's say a therapist tells a client, you know, you don't have to worry about that issue, whatever they're bringing in related to their sexual orientation or gender identity. So let's talk about something else. So really quickly changing the topic. And like I said, these are actually opposite ends of the spectrum, right? So the hope is that, you know, if somebody isn't talking about it, that, you know, you don't really go down the road of saying, oh, well, we really need to focus on this one thing that you didn't bring up at all, versus the other end where somebody brings it up and then you avoid it, or you say like, oh no, let's talk about something else. So the message here is that you should be uncomfortable talking about your sexual orientation or gender identity. Okay, so we have a clip here about students who are in schools of social work talking about their experiences. Let's see if I can get this to...
How in her religion, they view homosexuality as an abomination. And the class sort of got quiet, and nobody really knew how to respond to that, including the teacher. I actually had these thoughts going through my head. One of the thoughts was, what this student said was bullshit. And then another thought was, but maybe she's right. I went from being a healthy gay man, as healthy as I can be right now in this climate, to...
I'm going to pause it just because I think the dubbing, the dubbing's off. Is it okay that the dubbing's off? Or I'm not sure how to quite fix that. But let me know if you want me to try to fix it.
I'm a faggot again. And I'm back in junior high school or elementary school, and I'm trying to walk through a hallway. And I realized that maybe this is what we're talking about when we're working for clients.
The professor asked what kind of factors plays into experiences of people's lives, and somebody said sexual orientation. Then a student said, well, what's with those students in my undergrad who started sleeping with women? And another student said, oh, you mean lipstick lesbians? And another student very quickly said, gays and lesbians I can understand, I guess, but what's with those bisexuals? Do they like men or do they like women? And the professor turned around and said, I don't know. She cut the conversation and discussion off at that point and said, I don't want to get into this any further, and changed the subject.
Well, the task supervisor said that she was a little concerned about the fit with me and the field placement that I had. And she said that the organization that I was working with was really conservative, and she didn't know if I would fit in. The first thing that came to my mind was it was because I was gay and that, that I didn't dress like a girl. My task supervisor was basically like really nervous and upset, and was saying that she had been up all night, she hasn't been able to sleep since I've been there, because this was like a problem for her and something that she's been constantly thinking about, and if she jumping to conclusions by thinking the population wouldn't accept me, and that it wouldn't be appropriate for her to go ask me to buy a whole new wardrobe. Yeah, I wouldn't wear a dress, and besides, my hair would not grow overnight. Like, I remember saying, like, and I'm not going to wear makeup. She just began to say, like, other options, like, either, like, maybe I could stay at the field placement but never go to the meetings, like, work with the population that was in-house, which was not anything what I was supposed to do, and that basically I would just stay and do it, like, work in this building, because nobody in this building would have a problem. It's just when she sent me out to the community, she felt like they would have a problem. She's like, well, how are you feeling? And I was like, I feel like I'm being discriminated against. And she said, don't use that word, discrimination. That's not what's happening here.
And this was an exercise that for people who identified as straight to imagine that they were gay or lesbian. So as I was laying out what to do, one woman said, oh no, I absolutely cannot do that, it's against my religion. And she said, well, I don't mean anybody any harm, but I wasn't raised this way. I was taught that it was wrong. I can't do that. And then another student, in a furious tone, said, the NASW Code of Ethics does not allow this. It is not considered professional behavior. It's not okay to discriminate based on sexual orientation. You're not allowed to do it. It's wrong. Can't do it. Get over it.
Okay, so those are just a couple of examples. Some of these are with some of the microaggressions we're going to talk about in just a minute. But I think what I really wanted to highlight and why I put this here is the dismissal piece. This, this thing came up in class and the professor didn't say anything about it. And this is, so the first person was talking about feeling like he was going back to junior high again when, something was said in class. And then the next person had talked about how, I can get on board with gays and lesbians, but those bisexuals, and then the professor being like, yeah, I don't know. I mean, so the thing is that the microaggression may happen from somebody saying it, and then the microaggression happens again by a person whose role it is to actually start the conversation going or to intervene. So it's like a double microaggression that happens if you don't address it. So those are just a couple of examples of things that might occur. There's also this thing, and people usually giggle a little bit when I give this example here, but this attempts to over-identify. Any of these can happen really with any marginalized group, but in this specific example is maybe a social worker making this frequent reference to a distant acquaintance or the one friend who identifies as LGBTQ. My third cousin is gay, and really trying to focus on that piece. And the message here is, I understand your issues because I know someone who's LGBTQ, or I'm not biased because I know somebody who's LGBTQ. And the thing is that this stuff happens all the time and it's well-intended, which is kind of the definition of most of these microaggressions, which is that the person who's doing it is trying really hard to convey something, but really what's happening is this unintended consequence of what your actual message is. So for me, if somebody were to say that to me, like, oh, my third cousin is gay when I tell them that I'm queer, I think I would want to know, like, what is that this person actually wants me to know? Is it that, A, are they really uncomfortable, but they're trying to share with me that they're not, so that's the microaggression? Or is it that you really want to connect with me? And if you really want to connect with me as a person, instead of telling me you have a distant cousin, why don't you tell me that you want to connect with me? Oh, I've really wanted to know a little bit more about some of these things. Maybe we could have a conversation about it. I'm really interested. Oh, you do LGBTQ research? That's cool. Let me hear about it, right? So if you really want to connect with me, then try to connect with me. But part of it is thinking about what is it that you're actually saying and what's the message that's coming across. I have some of these cartoons that I got off of BuzzFeed, which is my new favorite thing to be able to use as a teaching tool. But we have up here what somebody actually says and then the message that actually happens here. So somebody goes up to a trans person and says, I love trans people, right? And the message here is that I'm fetishizing you as a person. Like, why do you have to tell that person that you love them? And what's the whole purpose of that here? We also have another cartoon here. Oh, I don't have a problem with trans people. Right? The message is, I have a problem with trans people. Anytime you have to say something like, I don't have a problem with you, or I don't feel uncomfortable around you, if you have to say that, there's something there. Or like the, no offense, but if you have to say that about what you're about to say, that probably means there's something offensive that you're about to say. You just don't want the person to take offense to the offensive statement you're about to say, right? So part of this is really considering, why are you saying something? And really kind of considering internally, what do I actually want to do? If I actually want to have a conversation, then I should have it. There's probably a different way that I can word this. Or if I really have this bias, I shouldn't say this to this person, so I should go talk to a supervisor or somebody else about this feeling that I have. All right, so another specific type of microaggression are expressions of normative bias. So kind of think about your environment that you have around here, around the School of Social Work. So what do your flyers look like? What kinds of books do you have out and about? Do you have any type of rainbow flags or trans symbols that are out and open in the department? I mean, part of that is thinking if you have them, that's awesome. Could you have them more? Could you really kind of think about what your environment looks like here? And for the field experiences and the prac sites where you send your students, what are those like, right? Because even though they're outside of the School of Social Work, it's still, you're responsible for your students' training. So kind of thinking about what does that look like and how much are you vetting what these expressions are? Or also, like if somebody is trying to clarify a student's or, faculty's LGBTQ identity, asking, oh, is that your preference? And this is something that grates on my nerves. People actually ask me that all the time. And it's the weirdest thing to me. So one of the examples that I give is saying, oh, my girlfriend and I, we just love to ride our bikes or something. We like to go cycling, right? And somebody goes, oh, is that your preference? And the weird thing to me is that I'm like, yeah, I really love to ride my bike. Actually, that is a preference of mine. But that's not what they're asking. They're asking, is my girlfriend a preference of mine? And I'm thinking, well, why do you even have to ask? I'm actually stating this as a fact for something that is an experience of mine. But this sense that you need to ask me if that's my preference, and there's something going on for you about some type of discomfort or something that's going on for you internally that you feel like you need to ask me about this. I have this quote on here from a 29-year-old bisexual cis man who's a student on campus. This was a study from Stroop et al. In 2009 where they were really talking to LGBTQ students on campus about this. But he says, I feel constantly bombarded with assumptions of heteronormativity. Do I go along with it? Do I make a point to speak out against it? How do I respond when an advisor, professor, or new acquaintance simply tries to be friendly and ask if I have a girlfriend? Just the simple truth or the whole truth? Do I really want to get into a conversation about sexual orientation with this person? Is it worth the risk of coming out to the advisor or the other faculty member, and on and on? That's the challenge. I'm comfortable with who I am, but my perception is that the rest of the world is still catching up. And I think the hard thing about this is that, you know, this person talks about being a bisexual man and really talking about, well, if you ask me if I have a girlfriend or a boyfriend, even if you ask me if I have a boyfriend, that's still going to be a complicated response that I give, because that, you know, my identity encompasses much more than that. So part of this is kind of considering how hard it is to be an LGBTQ person either on a campus in a prac site or as a client, and what it means when you're trying to navigate some of these situations. And the message here is you're abnormal. So if you don't fit the way that we have everything listed in our heteronormative organization, if you don't fit how we're representing lots of different identities, then there's something wrong with you. There's also the assumption of pathology and abnormality. This is more specific, I think, to mental health providers, but this can happen in any of the classrooms or in any of the sites that you have your students go to. So let's say a social worker tells a client that their diagnosis of gender dysphoria indicates that they have an inherent mental disorder, right? We have it in the DSM right now. We have gender dysphoria as it's indicated as a mental disorder. And if you have a trans client coming into your office and you say, well, you have a mental disorder, I think it's something to really think about in terms of the training that you all have and how you talk about these issues, because part of it might get a little complicated if you need to give the diagnosis for somebody to actually get some type of treatment. But if you're actually telling somebody they're inherently disordered because of their gender identity, then there's a difference between those two issues, and how are you all talking about it when you're doing training. The message here is that your identity is bad and that there's something wrong with you. And I'm not going to go through the quote because we are short on time. Here is an example of the pathology piece. Let's see.
I'm Nephi Niven, and I'm from Murfreesboro, Tennessee. When I started dating boys, it was all secret, and I wasn't telling most of my friends. Actually hiding my actions made me sick to my stomach. I went to my doctor's nurse practitioner and told her that I was sick all the time. My stomach hurt. And she gave me some like antacids and sent me home, and I was back a month later saying, it's worse, and I'm throwing up all the time. And she said, there's something you're not telling me. So I ended up coming out to her first. She said that this is, you know, a difficult time in someone's life, and that it might help me to get some support. And I made an appointment at the Middle Tennessee State University Counseling Center and was sent in to see this male therapist. And when I told him that I was gay, I was thinking about coming out of the closet. He listened thoughtfully and said that he was glad that I had come. And then told me that I would need years of therapy. And as I didn't really understand what he was saying at first, but as we spoke, I asked him if he thought that I needed the therapy as support to make this difficult move in coming out of the closet, or if he thought that I needed therapy because I was gay. And he made it clear that he thought that gay people were, you know, came from violent backgrounds and were likely to be violent and abusive people, and that they needed lots of therapy. I was very angry, And I started yelling at him, and I told him that there was nothing wrong with gay people and that they weren't sick, and they weren't gay because they came out of abusive families or situations, and they weren't abusers. And I grabbed my coat and I ran out of the office, and over the course of the next couple of weeks, I started to summon the courage to tell my friends and my family. And I think having had that experience of standing up for myself and saying aloud the words that there's nothing wrong with gay people and there's nothing sick about them, helped me realize that that was true for myself. And having stood up to someone that, you know, was capable of saying such mean and hurtful and hateful things when you put yourself in a vulnerable position, I think proved to me that I had the strength to do that. So after I came out to my mother, I told her what had happened when she asked if I had told anybody else. And I was telling it to her kind of as a story. But she was a professor at the university, and she was furious. The idea that somebody had told me that there was something wrong with me or sick about me was more than her Italian temper could take. So she took it upon herself to go to the head of the student counseling center and complain. I received a call from that woman who was very apologetic and couldn't assure me that it would never happen again, which is really what I wanted to hear, but did offer to see me and talk to me about it and make sure that I was okay.
Okay. So I use this as an example because I think in my experience with training students who are learning how to be therapists or work in these helping fields, overwhelming, they're like, oh, you know, I'm not like that. I would never tell a client or somebody who I'm working with that there is something wrong with them because of their LGBTQ identity. And I hear that over and over again, and yet I hear stories like this all the time. So there has to be a disconnect, because if people are telling me I don't do that, but then I'm hearing, you know, almost every LGBTQ person who's come in my office has had a negative experience with a therapist or with somebody who's in the helping field, and how do you make sense of those two things at the same time? So if you think, oh, I would never do something like that, I think that's awesome to kind of consider that internally, but maybe what is it that you might be doing that could also convey something to somebody that's some type of unconscious bias, or your peers are probably doing some of this too. So if it's not you, what can you do to help intervene? So part of this is kind of thinking about this bias of, I'm not like this, and we live in a liberal city in the middle of Wisconsin, like, you know, this stuff isn't happening. You know, partly considering, I hear it all the time, so it's happening. So we need to figure out what we do within our training programs or when we're working in organizations, how we want to intervene. Also, there's the warnings of the dangers of identifying as LGBTQ. So let's say a social worker asks a client, are you sure you want to enter this lifestyle, or have you really thought this through? And you know, I think, again, when I talk with people and I am doing some of these trainings, people are like, oh, I would never say that to a client. But I think, what are you conveying if you are maybe worried about their safety or worried about, you know, some of the things that might happen to them? Sometimes this is how it comes across. So part of it is kind of considering, how are you talking with people about safety if you are actually worried about them? Because if you word it like this, the message that it comes across to an LGBTQ person is that any problems you face are your own fault for choosing this LGBTQ identity. And also, let's say a client discusses experiencing discrimination, and a social worker says, well, you know, this lifestyle does bring certain problems with it, right? And the message here is that systemic oppression doesn't exist. And I think you heard one of the reasons why I include that whole video from the beginning was that person who'd said, oh, this is discrimination. You can't just like not place me at a site because you're worried about some of these things happening. You have to actually do something about it. And that the field placement person had said, oh, it's not discrimination, you know, being very defensive and kind of denying that experience. That, you know, this oppression doesn't exist and I'm not a part of that. Okay, so also making stereotypical assumptions about LGBTQ clients. So let's say a gay male client describes his weekend and the provider says, you were in a hardware store, right? So having a stereotype that gay men wouldn't be in a hardware store. Provider tells a femme woman, you don't look like a lesbian. You know, people tell me all the time, you don't look queer. I would have never thought that you were queer. You have long hair. Sometimes I wear makeup and dresses. You know, I couldn't be queer. And the message here is that all LGBTQ people are alike, and I don't need to make an effort to get to know you as a person or as an individual. And then we have pieces here about, oh, you're trans, but you look so good, right? So this assumption about how trans people are supposed to look, and these pieces about the messages that you're giving. So trans people are ugly would be the message that you'd have here. And then also this dismissal or denial of heterosexism or transphobia. So we have a couple here where a provider says to a trans patient or client, oh, you're probably just gay. You know, it's probably not you being trans, you're probably just gay. Or to any LGBTQ patient or client, so you're probably just experimenting. And having this dismissal that you could even have this identity or this experience, or a provider telling clients that they're being paranoid when they're experiencing discrimination and microaggressions. So I have the message here blank, but I thought this is the audience participation moment. So what's the message here if you see anybody telling somebody this, or you tell somebody this yourself?
Do you know more about it than they do as well?
Yeah, like I know more about your experience. I'm the expert about you as a person, and you don't know anything about yourself. Anything else? Any other message that you see here? Yeah.
It's basically telling them that their identity is not a valid identity.
Yeah, that's right.
Basically making them invisible.
That's right. So your identity is invalid. It's not a real one. So this idea of real identity, which I have here. So, telling a trans person, you look just like a real woman. So trans people aren't really women, having this idea here. Or, are you really trans though? You know, this idea, you're not really trans. So this BuzzFeed one right here comes from a non-binary, a genderqueer cartoon series. So like, oh, well, you're not really trans enough. Or what is a real trans person like? Also using incorrect terminology. So maybe having an assumption of somebody's sexual orientation, gender identity, labels, pronouns, or names. I had an experience on my job interview here recently where a person on my job interview kept on labeling me as a lesbian. And I told this person many times that I actually identify as queer, or bisexual is fine too. So this is something that we'd known, and so every time I would correct this person, and she'd be like, yeah, but as a lesbian. And I'd be like, well, it's really irritating and annoying to me that this is happening, because not only did you know this before this interview, but also I'm correcting you during the interview. And also, why are we talking about this particular thing on an interview? Granted, like I do LGBTQ research and I open myself up to these kinds of questions, but part of this is kind of considering the types of assumptions that you have about what you think somebody's identity should be, especially since I'm in a relationship with a woman, the kinds of assumptions that people make. Also, if you're in a waiting room, if you're in a place that has a waiting room, if you call out a legal name in the waiting room rather than the identified name on paperwork, that's something to consider for a lot of you who are at field experiences or prac sites. Using the incorrect terminology after being corrected, so I just mentioned my experience with that. Telling an LGBTQ client that it's too hard for you to use the correct terminology. So really making it about you rather than making it about the person. And what's the message here? Yeah.
That someone else's identity is inconvenient for you?
That's right. That's exactly what I was going to say. That it's inconvenient. That you are an inconvenience to me. It's too hard. Or I don't want to have to remember this stuff. Anything else that you notice here? All right. So we have this thing here. It's just so hard to switch pronouns. So trans people are an inconvenience to me. That's the message. Or also, they pronouns are too grammatically weird. Heard that. Or it's too hard for me to use they, them, theirs. So grammar is more important to me than respecting your identity and having those pieces. I have this last part on here about asking a trans person about their anatomy. I just have don't do it. I think that there might be some times when you are talking about surgeries or talking about things for transition-related care, if you have a client who's coming in and talking to you about that kind of stuff. But unless it's absolutely necessary for the type of care that they're requesting and actually saying to you, I I need to talk to you about this, then you should never be asking anybody about their anatomy. I don't ask any of my clients or my students or my colleagues about any of their pieces of their anatomy. And in fact, I mean, the client stuff may come up sometimes because I write letters, and sometimes people want to tell me certain things that it's important for me to know from their perspective. But students or colleagues, never. Right? It's just a golden rule. And I say this because at my previous institution, I helped a student file a sexual harassment complaint because his advisor, this is in a graduate program in a helping field, his advisor asked him about his breasts and his vagina the first time that they met. And I know I see some shocked faces here, but I think the piece of this is it's that I think there's this message, and I have this message blank, but I'm just going to say that, if you are asking these pieces and you think it's okay for you to ask these of a trans person, it's because you're objectifying this person. You're not thinking that they're actually, oh, I'm not sexually harassing you. It'd be sexual harassment if I was asking somebody I perceive as being a woman about her breasts and her vagina, but I don't perceive you as being a woman, so I can ask you about these parts, right? And I use the example because I've been somewhere where this happened, and I helped somebody file a claim about this particular experience. So this isn't just a nebulous thing, it's something that happens, and I would say just don't do it. They have this BuzzFeed piece, when are you going to have surgery? And this idea, too, is that also, not only are you making an expectation that somebody's going to have surgery, but also you just shouldn't be asking people about those personal pieces. Okay. So we have about 5 minutes before we have some discussion. So I think the part that I think I'm going to spend the most time on in these next 5 minutes is not the impact of microaggressions, but this exists here. So if you want to talk about it, we can. But this piece of how you actually address and eliminate microaggressions when they happen. Like I said, we're all going to do it. It's just this part of kind of accepting that, we all have unconscious bias, and this is something that's going to happen at some point. But the whole idea is that you come to talks like this, and you become educated so you can do it less, right? Because awareness is the first piece of actually learning how to not microaggress. But because we all do have unconscious bias, this is going to happen at some point. So kind of having this piece of humility and saying like, okay, I know that this might happen at some point. So when it does happen, how do I want to notice it? So part of this is being observant. So when I am talking to this person, do they suddenly start to withdraw from the conversation? Do they seem like they're not really as into the conversation based on something that I think I just said? Listen when somebody actually raises a concern. Get feedback on the interpersonal behavior and environment. So part of this, I just got back, I was consulting in Cincinnati over the last, on Thursday and Friday, where I talked with groups of students who were in departments like yours. And it was fascinating talking to students about the kinds of microaggressions that they've experienced in their own departments, and then talking to the faculty about it. And the faculty were like, oh no, that doesn't happen. I'm thinking, if you tell that to students, this is why students are bringing it up, because that's the reaction that you all are having. And if I were a student, I wouldn't want to bring it up either if that was going to be the reaction that was happening. But I'm a consultant, so it doesn't bother me, because I can just tell you this, and then we can kind of talk about how you should be responding. So I think part of it is, how are you actually getting feedback, and then how are you responding to that feedback when it's happening? Also, interrupting microaggressions when you witness them. Also, it was funny, I asked the students, I said, when do you want faculty or somebody who has more power to actually interrupt a microaggression when they witness it? And students overwhelmingly have said, I want it to happen in the classroom, but I don't necessarily want it to happen if I'm in spaces that are more student-oriented, right? So if we're at like a social gathering or something, I don't want a faculty member like swooping in and using their power in that way. But if it's in the classroom, that's an educating setting, so it's your role to use your power in that way. And I thought that was interesting feedback. I have this slide on here about, when I get defensive, I have all of these reactions that happen. And trust me, like when people say that I've microaggressed them, my first reaction is a defensive one. It's just a normal reaction to have. I get hot, I blush, I get embarrassed, I get a little sweaty, right? So like these things happen to me when I start to feel defensive. So kind of think about, what's your reaction when you start to feel defensive? How do you know when that's happening? And usually it's because I feel ashamed. That's usually what the blushing is about. I feel embarrassed that I did this. And then I also want to be like, but that's not what I meant. I didn't actually mean to hurt you. That's not what I actually wanted to happen. But then I have these questions about myself. Like, what can I do about it? What is this person going to think? What are other people going to think? So part of that is kind of taking yourself and thinking about the self-awareness around the reactions you have when somebody brings this up to you, and saying, this is normal. It's normal to have a defensive reaction, but I shouldn't put my defensiveness on this person who's coming and talking to me. So the way that I would say to do this is, you'll feel defensive, that's normal. Take a deep breath. that's kind of the first piece of this is, all right, this person just said something, I don't believe that I did it, or I don't want to believe that I did it, but I'm gonna kind of sit with this, and then I'm gonna listen. I'm gonna actually listen to what this person tells me, and then don't tell the person, oh, I didn't mean to, or that wasn't my intention. And that's usually what people want to say when a microaggression happened. The person knows you didn't mean to, and they know that it wasn't your intention. Every time I've been microaggressed, well, I shouldn't say every time, but maybe most of the time, I don't think like, oh, this person really wanted to hurt me. I think, this person said this thing, I didn't like it, didn't feel good, and should I do something about it? That's usually what happens to me. So don't say that it wasn't your intention, you didn't mean to, because that makes it about you rather than the person who's coming to talk to you. And apologize. Let them know that you've heard what they've said, and then say something like, thank you for letting me know, and I'm sorry that I hurt you. And then, if you're feeling really upset, and you really need to process it, don't process it with the person who came to talk to you about this. Process it with a colleague, process it with a supervisor, or with somebody who you trust and you can consult with. That way you don't make it about the other person, and you can really get through some of the stuff that if you're having a strong reaction, you can talk about it. All right, so we're at time, so maybe I'll just bring us to the last slide. So you can have, this is my email address. If you all want to contact me, ask me questions, I'm available to chat with you about some of these issues. I know it was kind of a quick snapshot related to LGBTQ microaggressions. I have a lot more to say on the topic, but at least this is the beginning. So we have a few minutes for questions and conversation if you all want. We can have a discussion.
Yeah, I guess something that I'm kind of struggling with right now, I'm applying to jobs everywhere and having interviews. And so I don't want to like reveal myself by happening to talk about my partner, but then I feel like if I refer to them as my partner, then that kind of already reveals myself. So then I feel like, well, should I just reveal myself?
Yeah, I mean, I think that that's a tough one because it seems like, I honestly go with whatever you feel like is going to be the most authentic and important for you, because there's not a right way of going about this. I would say I personally have a lot of privilege in my experience. I do LGBTQ research, and so I feel like you can do LGBTQ research and not identify as queer or trans. But honestly, I feel like I kind of out myself already, so I've made the personal decision to just be totally out. But there are a lot of people who don't have that privilege, and you might feel like you're in that position, and it's okay to not disclose any of that information. I mean, there's this economic reality that you have of needing to have a job. So that doesn't give you the answer, but I do think like to have some self-compassion if you choose to not disclose that information. And that if you really want to be able to share that information, then I would say, get some support from people around how you want to do that. I'd be happy to talk to you about it. I mentioned the privilege piece because I've always made this decision of like, if this place doesn't like it, then I'm not going to work there. And that's a privilege for me. I have a PhD, I have all of these pieces that I think give me some of those pieces of privilege. But I have made the decision that, if I'm at a place that won't let me be who I am, then I don't want to work there. And so, it's a little bit of a complicated response, but I'd be happy to talk to you more about it if you want some strategies. Yeah.
So a few of us in the back row, we work in Child Protective Services, which is a system that's like based in heteronormativity at its foundation. So I'm wondering what sort of advice you would have for addressing microaggressions that are kind of inherent in the way that we are doing the work in the first place.
Yeah, I would say, so part of it is kind of like, I kind of take this approach to my privilege. So part of it is thinking about how much power do you actually have in the system, and who can you get on board who actually has power if you don't feel like you have it. So that's like step number one. And one of the experiences that I had with this was the last organization where I was working, I was running a bunch of trans groups, and we didn't have any restrooms that were really supportive for the people who were coming in and who I was working with. So I wanted to get the bathroom signs changed and the bathroom situation changed in my workplace where I was working, but I was like, I don't know that I have a lot of power. So I really went about it trying to find, okay, so I need to ask the dean for this, but I don't think he's going to be on board unless I get a bunch of these other people. So I'm going to get associate dean for diversity on my side. I'm going to talk to that person. I'm going to talk to these particular people. I'm going to write up this report for why this is important and it's psychologically damaging to not have these support systems in place. And then we're going to present all this information to the dean as a group. So I just use that as an example of like, you need to get people who have power who are on your side. And part of this process is really being okay with putting some time and effort into writing up reports or doing some research to say this is why this particular piece is important. And there is a lot of advocacy in the social work movement related to things like having residential treatment centers not be these like gender segregated places, or really thinking about where you're placing kids, or some of these pieces that happen, and I'd be happy to send you some of those reports. So I think part of it is there's a lot of people who are doing amazing work in this, so like not reinventing the wheel, but getting people who have some power on your side. And I'd be happy to kind of help you with that. Like, how do you actually get people in power on your side? Are your faculty going to be able to help you with push some of this forward? So I think there's this piece of social justice and activism that's going to be included in this, but it's not, I've experienced a lot of positive reactions to being in these systems that are very like rooted in heteronormativity and cisnormativity. People tend to respond really well, but I go about it in a way that I feel like I'm going to have a pretty good success rate. Does that answer your question? It doesn't give you specifics. Yeah, I'd be happy to talk about it. I mean, I have lots of experiences doing this. And I will say, I think because I come about these situations with this privileged idea of like, I'll just go into private practice if I lose my job, right? So I think I have this piece of like, I'm gonna just, fight for this stuff. But I also fight well within the system, right? Like I also play in the system too. So, and I really enjoy being somebody who's also working within the system. So I think you kind of have to wear these hats of, people tend to respond well to my personality style, so I have that piece of kind of like a direct yet gentle person, so I think people tend to respond well to that. But I also have an attitude where like I need to work at places that are accepting of these things, so I'm going to go ahead and do what I can. So if you don't feel like you have that privilege, who can you get on board who has that?
I guess this is somewhat related, but working in outpatient services, I have to do a lot of kind of follow-up with the medical profession, and that's specifically related to my trans clients. And I know, if we're looking at pathologizing, it's one thing to be a social worker and also a trans person to be like, well, this is definitely not a mental disorder, it's the systemic social impact of being transgender and all this stuff. And then you have to coordinate care with doctors who there are very few resources even in Madison.
Yeah.
And so getting to the how are you making those changes systemically, and how are you kind of being forceful yet smart about how you're working the system. I know I've had to do that in my personal life, but then doing it on behalf of clients every single time gets so draining. So do you have any information related specifically?
Yeah, I think there are two pieces of that. One is like when being an activist drains you, especially when you have shared identities with the people you're trying to advocate for. So that seems like one piece, and I can kind of talk about that. But the other piece is kind of how you navigate these systems. So like for me, when I'm writing letters for trans clients, for example, I never give them a diagnosis of gender dysphoria. I always say, if I have to include it in my letter, I'll say this person meets criteria for, right? I never say this person has this. And so I do that if it's something that's required in the system. And then I do lots of trainings like this for medical providers. So my thought is, I'm going to try to get this person services and do this way. I'm going to try to do some wordsmithing here. And then I'm going to do trainings for these medical providers around these issues and how we can maybe do a more informed consent model or something else. So kind of attack it from both sides. Like I'm going to do some training and do some awareness pieces with providers who are in this community so that I can maybe get them to be at the point where they're not asking for this. But in the meantime, I'm going to try to word some of these things in a more affirming way so that my clients can get the services that they need. Does that?
Yeah.
So it's like, so that's a more practical part. The other part's a longer discussion about burnout. I think for me, I realized how important, I know it's like I do all this caretaking for other people's mental health, and when I've been in situations where I felt like there hasn't been a lot of inclusivity. My own mental health has been pretty severely impacted. And honestly, I think this isn't my advice to everybody, but I've actually had to leave some of those situations. That's been some of the experiences I've had personally. But also, I think it's more of like, how much support do I have, and will that counteract some of these pieces? How do you all talk about self-care in the School of Social Work? Do you really talk about it, or do you kind of give it lip service? Like we give it lip service, and I'll say that. I'm a faculty member in my department, and I think we were like, yeah, self-care, and then we're like, why aren't you doing 10 billion things? You should take self-care for that person, and maybe, but for me, you still need to write these 10 papers, right? So I think part of it is like, how do you actually as a culture talk about self-care and set that up? And is it just, are you actually walking the walk rather than talking the talk? So I think part of it is, it's a longer discussion, but I think there are pieces of when do you know when to get out versus when do you know when to like continue to be in something and get the support and the self-care that you need. To be able to stave that off. And part of that is, like in my department, we're doing something like at Cafe Zoma on Saturday, where we're having how do you balance being an activist and an academic at the same time? So the department's paying for coffee for students who want to come talk about this. So like part of it is, what are you doing to be able to make sure that this is something that you're constantly helping to feed people's desire to be involved, but also feed their mental health? Does that, yeah. We have like 3 minutes left, so yeah.
So I was wondering if you have any suggestions for when you hear like other professionals saying things that are problematic, and how do you sort of call that out in a way that allows you to sort of maintain that professional relationship?
Yeah, I think that it's hard. If you're the person who doesn't have as much power, that's a different response than if you're a person who has equal or more. So I'll just say that. When I'm somebody who has less power, I often don't say anything, and I'll just own that. That I think you need to kind of weigh what this might mean for you in terms of your evaluation at a prac site or something like that. But when I have equal or more power, often what I do, like for example, I was giving this talk on Friday and somebody had mispronounced somebody who they were talking about. They used she, her, hers pronouns instead of they, them, theirs, and I just said, oh, that person uses they. Just kind of quickly, like, it's not even, most of the time it's not even like a shame, it doesn't have to be a shaming and it shouldn't be shaming, but it's just like usually a clarification, oh, this is what this person uses, or, if somebody says, it's harder if somebody says something that's more blatantly offensive, and so what I'd say is, if it's in a classroom setting, you can stop what's happening at that moment and really engage in a pretty good discussion about what's going on. If you have less power, like if it happens in a classroom, you can talk to the faculty member after and say, really wish we could have talked about this. Can we maybe set some time about for next week to have that conversation? So some of it is figuring out, if you can't do it in the moment, that's okay, but what is it that you can do where you feel like you have enough power to kind of try to figure it out? And coming back to microaggressions is totally fine. So I'll just say, like, you don't always have to do it in the moment. That often you can find an ally or somebody who has a little bit more power who can help you navigate the situation. Or, like for me, for example, with that faculty member who kept on correcting, who kept on calling me a lesbian, it was something where I was like, I don't want to talk about this because I'm on a job interview. So I waited until I got the job, and then I ended up talking to this person about it after, and we had a good conversation about it. So I think part of it for me is like, how do you time certain things? How do you protect yourself? Yeah, I hope that answers your question a little bit. I know we're about out of time, so if you all want to talk to me about this more, I mean, maybe you all have some ideas about where this talk could go more in depth, or if there are other things that you want, I'd be happy to talk to you more about it. But thank you for inviting me to come.